Welcome to Open BxRx Tuesday on BronxNet. I'm your host, Kibin Alleyne, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Disparities in healthcare is one of our country's biggest issues. However, for certain communities, those disparities are even more apparent. With a focus on disparities in dental healthcare, the New York State Academic Dental Center is providing a fellowship for early career dentists with a mission to provide this much-needed service in New York State. Joining me now to discuss the fellowship and disparities in dental health is the president of the New York State Academic Dental Center, Jonathan Teyan. Jonathan, thank you so much for joining me.
Thanks so much for having me. Really appreciate the opportunity to talk about this really important program and this important community.
Yeah, so let's jump right into it. Can you tell us a little bit more about the New York State Academic Dental Center?
Sure. So the New York State Academic Dental Centers, or NYSADS, is the nonprofit association of the 6 dental schools in New York State. And we have been around since the 1990s, and we really work on health policy issues and collaborative programming. So things that are important to all of the dental schools. And one of the areas that we've been very focused on the past few years is really the care that the dental schools provide for people with special needs, because the dental schools are really safety net providers for many communities that are in need of dental care.
So I want to jump in and talk about this fellowship that your organization is launching. Can you tell us a little bit more about that and why it was developed?
Sure. So we actually started this about a year and a half ago now. We had some pilot funding from the Mother Cabrini Health Foundation to test this program, to start the program. And really the impetus behind this was simply the fact that there are not enough, in our view, and in the view of the dental schools, there are not enough dental providers out there in general practice who regularly care for people with intellectual and developmental disabilities. And so we really wanted to look at ways that we can provide some advanced training for people who are coming out of dental school, coming out of dental residency programs, and give them that extra, year of intensive training so that they can go out and really be expert in treating people, particularly with, more severe forms of intellectual and developmental disability.
And you mentioned earlier that there are 6 schools. So would this fellowship be available at all 6 schools?
It is, yeah. So in fact, I mentioned we started with a pilot program last year, and we enrolled 2 fellows, one of whom is at NYU this year, another at Touro College of Dental Medicine. And actually, we were very fortunate and very grateful. In fact, New York State, particularly the state Senate, put up additional funding this year to expand the program so that we actually can place 6 fellows. And so we're in the process of recruiting fellows, and we're hoping to place 1 at each of the 6 dental schools, which is great because they're actually all geographically located around the state. And so we also want to make sure that we're able to serve IDD communities around the state.
So I want to talk a little bit more about the IDD community. Can you just tell us, a little bit more about that demographic and, why their needs are a little bit different?
Yeah. So intellectual and developmental disability can, it's like many diseases. It's really a range. There's a fairly broad spectrum of types of IDD. So things that people are commonly familiar with. Cerebral palsy, Down syndrome, autism. And one of the hallmarks really is that people with IDD, as I said, they really have access to care issues, particularly with dental health. And there are a lot of reasons as to why that's the case. But what ends up happening, and we see this pretty regularly, is that because they can't get regular comprehensive dental care, they end up having much more pronounced problems, oral health problems. And so a lot of them actually end up getting treated in hospital ORs under full anesthesia. And really one of the goals that we have had as an organization is to try to make sure that they have access to regular care. And regular care would reduce the burden on hospital ORs because they would have preventive care. And really, I think what this comes down to in many ways for people with IDD is just it's an inhumane condition where many people with IDD are waiting a year or more. We've even seen cases of almost 2 years of having to wait to get comprehensive oral care in a hospital OR. And, you can imagine the sorts of pain and discomfort that go along with that. And actually, it's not just the pain and discomfort, but also can contribute to other health conditions. And in extreme cases, really poor oral health can be life-threatening. And so, again, I think it's not a stretch to say that this is sort of inhumane to have people wait this long. And so we're really working to reduce the burden on hospital ORs and make sure that there's access to regular preventive care.
Now, I'd like to know, is the procedure like a bit different from maybe you and I, how we go to the dentist, we sit in the chair, we get our teeth cleaned and checked up? Is it a much different procedure, and is that why we need fellowships like this one?
Yeah, it can be, right? So again, it's intellectual and developmental disability is it's along a continuum, and so many people will go in and they can get treated in a general practice dentist's office without issue. Some people require more time to become comfortable in that environment and to become comfortable with their dentist, and so. Some offices will have, special rooms. And in fact, NYU started a center for people with oral health center for people with disabilities a couple of years ago. And they have a room where people can really get accustomed to, comfortable with that setting. And so it really calms them down. So there's extra time that's needed. And sometimes there's extra personnel and equipment that are needed to treat people with IDD. But for many people, we have relied on hospital ORs when that isn't necessarily required. And so we're sort of trying to move people more into being able to be treated in a general practice dentist's office.
Now, according to a 2021 survey by the state's Office for People with Developmental Disabilities, no region of New York State has the necessary capacity to treat people with severe to profound intellectual disabilities. Can you tell me a little bit more about that finding?
Yeah, that was very unfortunate, that finding. They've done this survey. The most recent survey by the OPWD Task Force on Special Dentistry was done actually during the pandemic. And one of the results is that, there really isn't enough capacity anywhere in New York State to sufficiently treat all of the need that there is for people with IDD. And in fact, we've seen this get worse, not better. During the pandemic, one of the side effects, actually, there were a lot of side effects of the pandemic, and we saw that there were health disparities across, many communities as a result of the pandemic. But one of the things it did, it really impacted budgets, and we saw as a result of that, that there were many hospitals that used to provide oral health care for people with IDD and were unable to do so and actually have struggled to reopen those services. And one of the reasons for that, this really gets to kind of this underlying structural problem, is that, this isn't only a training problem, but this is also an issue of how we as a society have prioritized our healthcare spending. And, many people with IDD rely, at least in part, on Medicaid. And so, unfortunately, Medicaid does not reimburse dentists at nearly a level that covers their costs. And so almost everybody who is treating people with intellectual and developmental disabilities is losing a significant amount of money. And frankly, the pandemic made it very difficult for many of these safety net hospitals to continue providing these services. So one of the things actually that, I mentioned earlier that our organization, ISADS, works on, we work on policy issues. And one of the things we'd really like to see, and we've started to have some discussions with New York State Medicaid about this, is we'd like to see an increase in the amount of reimbursement, especially for this population. As I said, it can require more time in the dental office, it can require more personnel and sometimes specialized equipment. But again, if we were to increase the Medicaid reimbursement for that, it would actually, over the long run, be cost efficient, because if we can prevent people from having to go into hospital ORs, that's really much more expensive than treating somebody in a general practice office. And so, if we can increase Medicaid reimbursement for sort of regular preventive care, it actually would save us money in the long run. And so we're trying to urge New York State to look at that again and make sure that we're not overlooking this population and that we're actually spending our healthcare dollars wisely.
Now, I think this is like a really important program. Can you just let everybody know, especially career dentists, how they can learn more about being a part of this fellowship?
Sure. So I mentioned that we are right now in the process of recruiting, and our application cycle is still open. So actually, if there are dentists out there, particularly early in their career, who have gone through dental school and a residency program and are interested, they can go to our website, nysadc.org, nysads.org, and there's information about the fellowship there, and a link to the application. And we actually did a webinar a couple of months ago. We had both of our fellows who are currently in the program talking about their experiences, and so folks who are interested can see that webinar as well, and just reach out to us. We'd love to hear from dentists who are really committed to this population, and we'd love to provide some assistance in helping people develop this part of their career and this part of their skill set.
All right, Jonathan, thank you so much for joining me.
Thanks so much for having me. Appreciate it.
We'll be right back with more Open BxRx Tuesday.